More than 16,000 cases of monkeypox have been reported from across 75 countries and territories since the recent outbreak. According to the World Health Organization, these cases now include 5 deaths as the virus continues to rapidly spread globally. There are now grave concerns that without a proper response to this growing outbreak, the world might just start battling another pandemic. Health correspondent Kemi Balogun has more in this report.
The World Health Organization is worried at the rapid rate the monkeypox virus is spreading around the world through new modes of transmission. This global outbreak has now been listed as a public health emergency of international concern. But in the same breath, the WHO's assessment is that the risk of monkeypox is moderate globally and in all regions except within the European region where the risk is high. In Abuja, we go out on the streets to get the level of awareness that residents have on monkeypox. We find Peter, who says he has come in close contact with someone living with the disease.
I've heard about it and I've seen someone with it. It's just with some big pimples, bigger than pimples like this, but inside look watering somehow. So like chickenpox, but it's not chickenpox. This one is very strong also.
Monkeypox is now becoming a pandemic too, because it has been discovered about 70 countries in the world.
I don't really know much about it, but I know that it's a disease that is spreading so fast, but I don't know. But government should just try and do something about it.
With about 7.9 billion people still living through the effects of COVID-19, the world is still not quite ready to be battling another global public health emergency of international concern. But with the rapid rate of transmission of the monkeypox, it is still uncertain if Nigeria's health centers, like others around the world, can cope with another huge outbreak such as this. In some hospitals, like the National Hospital, a high level of suspicion is placed on any patient who comes into the emergency unit with symptoms similar to that of monkeypox.
From the accident and emergency, once a patient is flagged or suspected, the patient is moved to the isolation ward, where we have trained infection control nurses who give the highest possible form of care.
Dr. Nnebogu also highlights steps to take to also prevent monkeypox.
Preventing it will be, in the first place, avoiding contact with those animals, avoiding contact with bushmates, and if you must eat or if you must come in contact with them, make sure it's thoroughly cooked and properly prepared.
The World Health Organization also reveals that there is a clear risk of further international spread, but the risk of interference with international traffic remains low at the moment. Kemi Balogun, TVC News, Abuja.